For most of us, the holiday season brings with it feelings of joy and happiness and satisfaction and love and family. But for those who have experienced loss or who have a history of abuse or trauma, the season can be anything but joyous. And for those suffering from combat-related post-traumatic stress disorder, the season often brings feelings of loneliness and anger and frustration and isolation. For most with combat-related PTSD, there's a lack of wanting to become involved or to avoid activities altogether. Activities such as planning for the season, shopping, buying gifts for those we love, getting into the emotions of the season, getting together with other people. And instead, those with PTSD often become withdrawn, depressed, sullen, or angry. Most vets with PTSD and those who care for and about them have not a clue why the sufferer can't get into the season or enjoy the season or be part of the family. They just get frustrated by them, or they grow to accept that's just the way they are. In order to understand why those with PTSD behave the way they do during the holiday season, it's helpful to understand the three major symptoms of post-traumatic stress disorder: re-experiencing the trauma in the form of thoughts, nightmares, or flashbacks, avoiding activities that may remind them of the trauma, avoiding people and social activities, and the symptoms of arousal, including not sleeping well, being easily startled, being hypervigilant and always on guard, and being angry and irritable. So re-experiencing helps us understand why people with PTSD may want not to go to social activities, may not want to recall the season or get involved in the season because the season may remind them of things that happened when they were in the combat zone. Perhaps they were away from the family and they feel guilty about that. Perhaps they saw at the holiday season death and destruction. Perhaps it is that the season itself, with its sounds and its smells and its sights, cause re-experiencing of those negative thoughts that the veteran may have, and may in fact increase nightmares, flashbacks, or thoughts. The symptoms of avoiding may help understand why veterans at this time of year may seem distant and detached, because it's better to avoid feelings than it is to re-experience them, or experiencing things like anger and irritability. So it's easier not to become involved than it is to become involved and not know what kind of feelings will come with it. And the symptoms of arousal help us understand why at get-togethers or shopping malls, things like loud sounds which cause veterans to be jumpy and startled might cause problems. It might explain why crowds may cause problems. It may explain why there is a feeling of just wanting to be away from everybody, because talking to people may bring about feelings of anger and irritation, and the vet worries that they may do or say something that will embarrass not only themselves, but their family members as well. So, in addition to the major symptoms of PTSD, the re-experiencing, the avoiding, and the arousal, there may be other issues. Veterans often may not have enough money to be able to afford gifts, even if they wanted to get involved in buying gifts for others. They may feel guilty about letting others down because they're not into the season like the rest of the family seem to be. They might start drinking or using drugs, and those substances may loosen the control, so it makes it more likely that the veteran might say or do something that may cause embarrassment. Many veterans find it easier to pick a fight than to explain why they're doing what they're doing. If they pick a fight, they just go to their room and they don't have to become involved. There are also issues having to do with spirituality itself. The season is one of spirituality, and many veterans avoid spirituality and especially religion. How can I go to church and be around a lot of people when I feel so uncomfortable there? How can God love me after what I did or what I witnessed in combat? How can there be a God anyhow if it was that God that allowed what happened in the combat zone I was in to occur? And that makes it difficult for many veterans to experience the spirituality of this season. So, what do you do about it? The main thing I can suggest is to get help. And we'll talk about that in just a moment. But in between, here are a few ideas that you might want to try. First of all, talk to your family and friends. Explain to them as much as you can, as much as you understand, why you feel the way you do at this time of year and why it's so difficult for you to become involved and they are involved. If you do go to things, make plans in advance. For example, have a signal between you and your spouse so that when you've had enough, when your anxiety level or anger level is too high, your spouse knows that's why you're exiting the room and doesn't wonder what happened to them, where did they go. Perhaps it's best to take 2 cars so that if you feel uncomfortable, you can then leave or your spouse can leave later or before. It may be that establishing new traditions for the holidays may be a good idea. For example, if being around a lot of people at parties causes you to have re-experiencing symptoms or anxiety symptoms, maybe it's best to start traditions where you and the family can go camping or go somewhere where it's private. There are a lot of ideas we have that might be of help. And what I'd like to suggest is that you go to the website, www.mybacktothewall.com, and look there for the suggestions we have about getting help for the PTSD and also arranging for techniques that may make the holiday season more manageable.